Hello everyone, welcome back to our channel. Are you ready to ace the OET Reading Part A? Today we are going to share some top tips and tricks with examples to make sure you're fully prepared. Let's dive in and make those tricky reading tasks feel like a walk in the park. As you are aware that Part A is an expeditious reading task, it will be having 4 text and within 50 minutes you need to answer. So after reading, you will answer a series of 20 questions which include matching, sentence completion, and short answer types. We already spoke about skimming and scanning in our last video. Just to give a gist of it, skimming means reading quickly to get the general idea, while scanning involves searching for specific details or keywords in the text. Use both techniques to save time and find the answers faster. So let's move on to our example text here. It's an example text, burn depth classification. You can pause the video and read it by yourself, but again, I will also read it for you. Burn depth classification. Burn injuries are categorized based on the extent of tissue damage. These classifications help determine the appropriate treatment and prognosis for the patient. Superficial partial thickness burns, first and second degree. These burns affect only the outer layers of the skin, the epidermis, and part of the dermis. The skin may appear red, swollen, and painful. Blisters can form, but the burn does not extend beyond the dermis. Healing typically occurs within a few weeks without significant scarring. Full thickness burns, third degree. Full thickness burns extend through all layers of the skin and into the underlying subcutaneous tissues. The affected skin may appear pale, waxy, or chair. There are no blisters, and the burn site may feel numb due to nerve damage. Healing is slow and often requires grafting due to extensive tissue distraction. Scarring and contraction are common. Mixed depth burns. Burn injuries may present as mixed depth burns, where different areas of the burn have different levels of severity. Some regions may be superficial, while others may extend deeper into the dermis or subcutaneous tissue. The clinician will assess the depth of the burn by considering both the appearance of the burn and the patient's response to the stimuli, such as pain sensation. The overall treatment plan is based on the average depth of the injury. So, this is the given text. Now, let's move on to our tip number 1. Questions in order. Do the questions in order. Start by reading and understanding matching or short answer questions in order they are presented. By doing so, you get a good overview of the text before jumping into answering the question. Example, let's say you are given a question like, what is a characteristic feature of a full thickness burns? So, if you see the text, you will notice that full thickness burns itself as a separate paragraph, right? So, by reading this part first, you will be able to easily match or answer the question by identifying the keywords like pale, waxy, charred, no blisters, right? So what you need to do is first to identify the keywords and you need to recall the words that comes in the text. And let's move on to our second tip. The second tip here is copy exactly from the text. For short answers in completion questions, it's essential to copy exactly from the text, ensuring no extra words or spelling errors. Example, here is a question given. What is the characteristic feature of full thickness burn? So if we see the text, what is the characteristic of full thickness burns? So here is the paragraph full thickness burn, and under that if you see the affected skin may appear pale, waxy or charred. So if you are writing the exact sentence or the words given in the passage, that you will get the correct answer. Suppose if you're writing the skin may look pale or blackened, that's an incorrect answer. Even though the content is same, but it's an incorrect answer. Because you need to notice that the correct answer should be an exact copy of the text while the incorrect one omits like important details and uses alternate wording. So never do that. And let's move on to the third tip. Keep your answers short. Yes, you only need to provide the essential information. Your answer should generally between 1 and 3 words. In fact, they will give you like answer in a word or 2 words or 3 words or in a phrase. Avoid writing extra details or full sentences. Example: what layer of the skin is affected in superficial partial thickness burns? And if you are writing epidermis, because that's the answer from the text. Sometimes, if you want to write outer layer of the skin, including the epidermis and part of epidermis, no, that's an incorrect answer because you need to answer in short. The correct answer is second and to the point, while the incorrect one provides unnecessary information. So please don't do that. And let's move on to our fourth tip. Write clearly. You have to write clearly. Your handwriting is legible if you're writing your answers by hand. If the assessor can't read it, you won't get that point. Imagine you write epidermis, but it's illegible and looks like EPR dermis. Okay, instead of I, it's EPR dermis. The assessor won't be able to understand the word and your answers will be marked wrong. So make sure it is neat and clear. And the fifth tip is manage your time. Yes, yes. The fifth tip is manage your time. You have limited time to complete part A, so don't spend too long on any one question. If you get stuck, move on and come back to the difficult question later if you have time. You are stuck on one question like what is the healing time for superficial partial thickness burns? It's just an example I'm giving. So you can't remember the exact detail from the text. Instead of wasting time, guess or leave it and move on. You might answer the rest of the question correctly, then come back to this one later. Okay? And with these tips and examples in mind, you are now ready to take an OET reading part like a pro. Remember, practice makes perfect. So keep working with sample tests, stay calm, and you'll do amazing. If you found this video helpful, don't forget to like, subscribe, and hit the bell icon for more OET tips and tricks. See you in the next video. Bye bye.